Good evening and welcome to our discussion for today. My name is Zintle and today I am joined by our lovely Sharon. Sharon, hello.
Hi, Zintle. How are you?
I'm well, thanks. How are you?
I'm good, thanks.
Thank you. So Sharon is joining us for our discussion today. So we're going to be talking about grief and bereavement, especially in the context of the COVID-19. So this is a very difficult and a very sensitive topic. And I use those words because, we're all going through grief in different aspects of our lives during this time. People have lost individuals. Some people have lost their jobs. And some people have really lost their social freedom, if I can put it like that. So Sharon, can you please maybe briefly explain to us what is grief or what does grief mean?
Yes, so thank you for having me. It's true what you're saying that grief is really a sensitive topic because I think this is a time where all of us are going through some sort of grief in our lives. So basically what grief is that it's a response to a loss. So it can be a loss of someone, like a loved one, or a loss of something even. For instance, you mentioned jobs, that people are losing jobs. It can even be loss of your life as you know it. I mean, that is the grief that all of us have been going through right now. Grieving our social lives, our old lives, the previous normal that we had. So it's basically the emotional pain that people feel because of the that is associated to loss with whatever it is that they might have lost during this time.
Mhm. So, with regards to emotional pain, I'm thinking a person could be experiencing emotions of sadness, of deep sadness, and emotions of pain.
Oh, definitely. I mean, grief goes through um, different stages. And I mean, just to mention some of them, that normally people would also go through denial,
Mm,
denying whatever it is that they might have lost, or not being able to believe that the loss has happened.
yeah.
And or you can also be going through a time of feeling angry
Mhm.
and frustration. I think frustration would be mostly common right now because, a lot of losses that are happening now were not anticipated,
Mhm.
and also depression, like a deep feeling of sadness because of everything that's going on, and even the losses that are occurring, that like people
Mm,
losing loved ones. I mean, when we look at the numbers of people dying with this
mm,
pandemic alone, you can clearly see that death has really become a reality that is closer than we thought. And also, some of the stages that other people can go through, it's bargaining,
mm,
trying to negotiate out of the loss, maybe with God, whenever it's like a loved one, or
mm,
even with your boss
mm,
now, a job, to say, can I try and do this to keep it,
mm,
etc. And also, I mean, acceptance. Some people eventually reach acceptance,
mm,
or even one, because I believe that sometimes it's not easy acceptance is not easy. And however, we all need to learn to somehow move on with our lives beyond the losses that we experience. So, I
mm,
mean, these stages that I'm mentioning, they do not happen in any order. I cannot say they're chronological to say that, okay, first you'll go through this, then that. However, different people experience different emotions differently. And
mm,
sometimes you feel that maybe you are past the denial stage, or you're past
mm,
being angry, past being depressed, and
mm,
feeling that maybe now you are able to move on, or that you have accepted, only to
mm,
find that other things go back to the place where you started, or somewhere in any other stage that you that might be confronting you at a time. So I mean, it's not a rigid list of saying this is how it goes, but yeah,
mm.
it's just some of that people can feel during a time of loss and grieving.
Yeah, sure. And I think you're mentioning something very important that in these stages, we don't go through these stages the same way, Some people can be experiencing frustration instead of denial, or more frustration instead of denial. So we go through them differently. There's no formula that immediately when you're going through grief, this is how you will feel initially, and this is how you will feel towards the end. And it can also, you said that it can also lead to depression.
Definitely.
Sure. Okay. So I don't know. Can you just
you can imagine what.
Okay. We can go.
No, you can go.
Okay. So yeah, I was saying that you also say that grief can also lead to a place of depression, and depression is accompanied by different symptoms, is accompanied by different symptoms.
No, wait, Zinipop, stop the recording.
Sure. So you also say that it can also lead to depression.
Oh, definitely. And I mean, some people even experience complicated grief, where it takes them so much longer to come out of that space of mourning the loved one, or of even grieving the situation that they have encountered, be it due to COVID-19 or otherwise.
So you mentioned complicated grief. So what are the symptoms that are associated with complicated grief in the context of COVID-19?
So basically, complicated grief, I mean, grief is a traumatic experience. However, it should be transitionary. It's not something that should keep you stuck in one place for a long time. So normally when you find a person experiencing prolonged grief, or finding it difficult to progress in their healing process, then they might be experiencing complicated grief or complicated bereavement. And some of the symptoms that are mostly common for people who are going through that could include sleeping problems, where you struggle with insomnia, or even sleeping at awkward times, maybe in the middle of the night, waking up and things like that. And also another symptom could be obsession with the loss. Let's say maybe you lost the person and now you're suddenly becoming with them and always thinking about the person, or thinking about the previous life that you had before you lost your job, and so forth. And also, I mean, a deep sadness that it's so unbearable. Like, people can sometimes really find themselves in a place of darkness where they are not able to move forward with their lives. And that can also even lead to lack of self-care, because it's also common to find that people, when they go through these things, that they withdraw from social interactions, that they neglect themselves, and they find it even harder to engage in their daily routines. You know, you might have found that you probably liked exercising, you would cook, clean, and do this. And even those tasks that may seem mundane become difficult when a person is going through complicated grief.
No, I sure you're really showing some insightful information. So I'm thinking, for someone who isn't sure, like what could lead to complicated grief during this time, how would you explain or describe that to them?
Normally what leads to complicated grief is losing a person more than once, maybe. Say maybe someone dies and then the following week another person dies from your family, or someone that is important to you. It could also be due to unexpected loss, you know, because sometimes you see someone in the morning and then they have an accident in the afternoon and nothing prepared you for that. You know, it's a loss that you never saw coming. So for instance, even the pandemic, you know, none of us coming, and it has come with a lot of undesirable things, like people losing jobs, and people even losing interactions with their loved ones. So there are some of the contributing factors that can make it so much harder for a person to have a healthy grieving process.
Yeah, sure. And I'm just thinking, right, last night when I checked the statistics of the number of deaths just in our country, it was on 2,844, right? And, you know, when you hear a number like that, you think, sure, it's big. But what we really never really consider is that for every unit in those values, it represents someone. It represents someone who is family to different people. It represents someone who is positioned in a certain system and is not there anymore, whose life has been taken away by the COVID-19. And I was reading something, and then someone said, because the minister updates every day with the statistics for our country, and he said, Minister, today when you announce those statistics, just know that one of those people is my mother. And and I don't know if I'll even be able to go and bury her due to the restrictions. And I'm thinking, sure, because we're under the COVID-19 pandemic, there are a lot of restrictions, and people are unable to travel to bury their loved ones. People, we even have a limitation of the number of people that need to come to a funeral.
That's so true, Zintle. And I think what complicates it even further with this whole pandemic, that you now have to deal with two things simultaneously. You know, we are all facing the pandemic, we are all facing lockdown, and then now in the middle of that, you also have to deal with additional loss, be it of a loved one or whatever it is that you are losing in your life. And I think also what makes it more hard is that people die alone because they have to be in isolation. And sometimes it may even be that we have a loved one in hospital and we're not even able to visit them because of the restrictions. And that might even make them feel that they are being rejected. Or we might also experience guilt to think that we didn't support them enough, like we would have been able to under normal circumstances. And also not even being able to give them the funeral we would have wanted to give them had it not been for the pandemic. Because you know how normally with funerals, people would they normally say that we want to give our loved one a dignified send off, you know, and for them, that might mean a funeral of a certain level of standard, with the coffin, the people who will come, and so forth. And now with the restrictions, people can't have that. You need to bury the person within a short period of time. And also, even with the number of people that can come to the funeral, it's very restricted. So that might even make the people who are experiencing the loss to feel like they couldn't even give their loved ones a proper send off. And I mean, also with the restrictions, it denies a whole lot of other people from attending that funeral, which then means people cannot find closure. Because at a funeral, that's normally where people want to go to find closure and to see the person off, and sort of express their final love for them. So with the restrictions, they may even feel that they are being denied that last opportunity. So it does leave people sort of hanging or feeling in a space of not being fulfilled with how they have dealt with the loss of that person.
And you really mentioned something which I find to be very, very relevant to this topic, that sometimes a person will experience feelings of guilt that they weren't able to go and bury their loved one, feeling that, sure, the person died alone because they were in isolation because of the COVID-19 restrictions to protect others, around them, and unfortunately they die alone. Some people are in different countries, and because of the travel bans, they're unable. So if, let's say, they're in a different country and they possibly passed on in a different country, their families can't go to bury them in those countries, and they can't be sent into our country for them to be buried by their loved ones. So that isolation, those emotions of regrets that you talk about, those emotions of guilt, and also culturally, I think societally, we are very big on support, especially when we go through difficult experiences. We want to be close to each other. We want to share these painful experiences, and we want to feel like we're not alone. We have people around us who are supporting us. And I know in certain families, people gather around and everyone comes from different places. They come together, they support each other, and just just that physical presence, just knowing that you have someone you can hang on to, because some days are really hard where you just want to cry. You know that you have a shoulder to cry on. You know that you can just look within the room and you'll find someone, although you've lost a family member, but you'll find someone. So I'm thinking, Sharon, what do families do? What do individuals do during this time where they're faced with grief? They've lost their jobs, they've lost their family members. What do individuals, what do families do in this context?
Yeah, it's true what you're saying. I mean, culturally, we believe in social support, I mean, especially within the African context, when there's a funeral, immediately the same day, the community is showing up, the prayer meetings, and there's just a lot going on. And now we cannot give people that. So it requires a different kind of support. Mm-hmm. So I always say that the first thing is to acknowledge that it is a different situation, and that the situation is hard. It's hard because of the restrictions and the things that people cannot do. However, I believe that it's also important to seek virtual support as well, because I don't undermine the power of virtual support. It's always good when people can come and support you physically, but then I believe that we should also make use of other resources that we have access to now. I mean, for instance, with video calling, with audio calls, with Zoom, with Skype. I mean, even professional help can be sought in that manner. So it's always good to make use of those resources. And I know that even psychologists and other helping professionals are making that platform accessible by offering to do counseling services on Skype and so forth. So I believe that you should also seek professional help, however way that is provided, and also taking the time off, because it's very easy to assume that we are on lockdown, people are in isolation, therefore you have time to deal with the grief. But I believe that it has to be something that is intentional, that now I am going through something else. I'm going through something that is difficult in my life. So I need to take time out, even if it means maybe cutting off your time on social media, because it can also be depressing to constantly be following news updates and bad reports and seeing the numbers flying and all of those things. It can hinder your healing process. So I believe that it's important to also create that space for yourself so that you can have the time to heal, and to also just bring in boundaries, like your social boundaries, because sometimes people would want to call you every day, or sort of do things that might be overwhelming for you at that time. So I think it's also important to communicate those boundaries to your loved ones and to those that are around you, that during this time, during that period where you're going through the situation, that you would like them to support you in this way. Because sometimes, I mean, we say things even to our loved ones or to people as they go through things without necessarily thinking about the effect that they might have on the other person. Things like, oh, they're in a better place now, or maybe even trivializing someone else's situation to say, but you have lost a job, other people have lost a loved one. I believe that every person's situation is a big deal, and never ever trivialize what you are feeling because you feel like someone else is going through something bigger. So what you are going through is big as well, and it is important that you also get the help and the support that you need, however long it takes for you to come out of that.
No, thank you so much for sharing that. And what I'm learning is that firstly, it needs to begin with ourselves, accepting that this has happened to me, accepting that I've lost that job, and my life is different now. My financial circumstance will be different. Coming to realization that you've lost an individual, and just being present in that moment of knowing that you've lost someone that you dearly loved, someone who really mattered to you, and you might have not been able to find closure in the normal that you used to know, but there's support. So it's the self, and then you move to a social environment where you find support. And unfortunately, we are restricted, so we have virtual support. We have virtual support where we can connect to psychologists, to counselors, and I know that the government is also doing so much to ensure that different organizations are available for people where they can have phone counseling sessions and virtual video sessions with different professionals who can help them with the grief and the experiences that they're going through. So we do have support. We do have support. We do have psychologists that are available. I mean, people who are in private practice have really moved their services to the virtual space, the social media, so that we can be able to connect. So we can be able to connect with them.
That is true, Zinte. And I think it might be helpful to find one person or whoever it is that you're close with that can hold you accountable to and walk the journey with you. Because other days are better than others. Some days might be worse than others. So it's always important to make use of one individual, or even if it's a community on a WhatsApp group or something like that, that can always check in to say, how are you now? How far are you with this? Is there can assist and so on. Yeah.
Yeah. So it's connecting ourselves with people that we know that we can rely on.
Yes, definitely.
People we know that we can depend on. And you also mentioned something that I think is very important, that we need to be intentional about how we use our social media, because it is so easy to be overwhelmed, to be consumed with the social media information. Because daily, I mean, for the past 3 months, we haven't been hearing very good news. And if already that is projected in the social space, and you're also experiencing your own loss, I mean, that is like a simultaneous occurrence of different painful experiences.
Definitely. And I mean, the other sad reality is that we don't know when this is going to end. We don't know when normal will come back, normal as we previously did. And I mean, some people are maybe even hopeful that maybe at the end of this, then I will have a memorial, or maybe at the end of this, my job will come back, or so on and so forth. So I believe that it is important to be aware of the reality, but also not to dwell too much on it. Like you are saying, that sometimes it's good to avoid, because some things are even on media are exaggerated, some things are false news. So it's also important to be mindful of that you don't have to take in every bad thing that is being reported.
Yeah, no, I totally agree with that. Like being intentional is so important. Although our lives
Yeah,
have moved to this virtual space, but we need to be aware of how we navigate it, because we can both use it for positive and for negative, in a sense.
yeah.
We can feed both ways from it.
Mm-hmm.
Yeah. So I think you really shared some very insightful information about what we can do, and what I think what we basically say in this platform is that let us have these discussions.
Yes,
Let us let each other know that you're not alone. That
yes,
that we all going through loss differently in different aspects of our lives. That
definitely.
that you can find help. Help is available. Help cannot may not be limited to a person, a psychologist. Help can be the people that you live with, just informing them of where you are, in terms of your feelings, that this is how I am and this is how I would like you to support me.
No, definitely. And I mean, just to also share my final thoughts, to say that there is no shame in asking for help. There's also no time frame to say that now it's been 21 days. You need to be getting over it. You need to get used to it. Definitely not. It doesn't work like that. But you know where you are. You know the pace at which you are going. So it's good to acknowledge that, and to, whenever you feel like you need extra support, to reach out and say that I need extra support. There is no shame in it, because sometimes people withdraw and they would rather maybe suffer in isolation, because they feel that maybe they're being unreasonable, or maybe they're asking too much. So I believe that regardless of wherever you are in your healing journey, in your process, it's always important to, when you feel like you need additional support, to seek it out. And I mean, also, it is a difficult time, like we have already alluded in our conversation, but I believe that with every difficult time, you know, hope keeps us alive, to continue being hopeful, to continue seeking positivity and doing things that, you know, uplift us, that empower us, you know, no matter how small, no matter how big. I mean, even making your bed in the morning, that can be an achievement, and moving towards moving forward with your life. So I think it's important also to do that, to feed, to continue looking after yourself and to feed your passions whichever way you are able to, in order to stay sane and to cope better with grief and losses.
I like what you're saying. I like that you're saying there's small things, simple things that we can do in this time to help us cope to help us cope with the grief that we're experiencing. You know, a simple thing as waking up, making your bed, it does really make a difference. If you like cleaning, just keeping your room clean for the day, just to uplift your spirit. So there's really something you can do. Personally, there's really
Yes.
something you can do. Sharon, thank you so much. I really have learned, have taken a lot from this conversation for myself as well. And I hope that anyone who's listening has really taken something for themselves that they can apply in their lives. Any last comments before we close our session that you would like to add?
No, thank you for having me. And I think let us continue being considerate towards one another and looking after ourselves whichever way we know how. And I mean, not dwelling too much on the negative, like I have said. I mean, times are uncertain. We don't know what tomorrow brings. We don't know what even the next hour will bring. But we can always be in control of what we of our own actions and what we can do to keep ourselves safe and to keep our loved ones safe. So that is my encouragement to all of you, to say that let us keep adhering to regulations, and in times of losses, let us continue seeking help and support the best way we can.
Thank you so much, Sharon, and thank you so much to everyone for listening. May we continue to keep safe. May we continue to take care of ourselves. May we continue to take care of the people around us, and know that although we are unable to find closure in the ways that we used to know how to, there's always a way. There are different ways where we can find help. There are different ways where we can reach out and find positive impact to our situations. Have a good night. Thank you so much for tuning in. Thank you.
Thank you.